Hello and welcome back to Clinical Cases. Today we're going to be looking at the second part of the urogenital block, where we'll be exploring the next 10 clinical cases that we were taught about in the urogenital system. These will be prostate cancer, UTIs, ovarian cysts, testicular torsion, embryological kidney malfunctions, polycystic kidney disease, genital infections, and benign prostatic hyperplasia. So let's get started. First of all, we learned about prostate cancer, which is the development of cancer within the prostate gland. Most prostate cancers are slow growing, however some do grow relatively quickly. The cancer cells may spread in the later stages from the prostate to the other parts of the body, such as the bone or lymph nodes. Initially, prostate cancer doesn't cause any symptoms, which is why it's so difficult to pick up and detect in an early stage. Because in later stages, it's when it becomes symptomatic and causes the patient difficulty urinating, blood in the urine, or pain when urinating. Essentially, you have to think about the normal physiology of the prostate gland in order to understand this. So the prostate gland is a small gland in the pelvis of the male, around the size of a walnut, that surrounds the urethra. So essentially, in the later stages of prostate cancer, when it is becoming larger, it surrounds the urethra, and it compresses the urethra, which is what causes that difficulty when urinating. Essentially, it's also important to consider the two normal functions of the prostate. So essentially, it produces prostatic fluid, which contributes towards semen, and it's good also to be aware of PSA, which is prostate-specific antigen, which is a glycoprotein made up of amino acids, which is secreted by the glandular epithelium of the prostate. It's there to liquefy the semen and allow sperm to be more mobile. Essentially, it's a good marker for cancer cells because it's in increased levels when there's cancer present. So these are the normal range values for PSA. However, these will be increased in prostatic cancer. It is important to be aware that other conditions, such as inflammation of the prostate or benign prostatic hyperplasia, is likely to also increase those PSA levels. So it's not exclusive to prostatic cancer that will increase the PSA. In terms of detecting prostate cancer, it'll be done by a careful history, a digital rectal examination, checking the PSA levels, and also potentially a prostate biopsy and imaging. In terms of how we grade prostate cancer, this is done using the Glasgow scale. So we take the two most predominant areas of cancer within the prostate, give them a score out of 5, and add them together to give a score out of 10. Anything with a score of 5 or 6 is determined low risk, and therefore we deal with this by surveillance. Anything with a score of 7 is determined intermediate risk, and this is usually monitored via surveillance or potentially radiotherapy. And anything with a score of 8 to 10 is determined high risk, and therefore with this you're likely to require surgery or more intense radiotherapy. Next, we looked at UTIs, and this is the presence and multiplication of microorganisms in one or more structures of the urinary tract, with organisms invading the surrounding tissue. So when we say the urinary tract, we're referring to the urethra, the bladder, the ureters, and the kidneys. It's a condition that's much more common in women than it is in men, and most women will have at least one urinary tract infection during their lifetime. Because of the fact it's more unusual in men, this is partly due to the fact that they have a longer urethra. It's therefore deemed a complicated UTI, and therefore it should be investigated further for underlying pathology, so for example prostate pathology. It's important to distinguish between the two types of UTI, so complicated and non-complicated UTIs. So a complicated UTI is where there's an underlying condition that increases the risk of the therapy failing. So this, for example, is in men, in pregnancy, in a catheter-associated UTI. An uncomplicated UTI is in an otherwise healthy, non-pregnant adult. It's good to know about these two terms here as well, asymptomatic bacteriuria, so this is where there's bacteria in the urine without any symptoms, and sterile pyuria, where there's white blood cells without bacteria and pus in the urine. Essentially as well, it's good to know the technical names for these, so a lower urinary tract infection is also called cystitis, and an upper urinary tract infection is called pyelonephritis. And it's important to be aware of these because the symptoms differ depending on the type of UTI. They're usually treated with antibiotics, nitrofurantoin being the most common. Moving on, we looked at ovarian cysts. So these are very common, especially with women who still get their periods. They're solid or fluid-filled pockets in or on the ovary. Most of the time they're painless and harmless, and they usually go away on their own without any treatment, which leads to the patient actually not knowing they've experienced ovarian cysts. Cysts are also quite common when you're pregnant. A cyst, however, does become a problem when it increases in size or it doesn't go away, and it can become very painful. There's also the possibility of cancer to consider, but this is quite rare. And the chances of developing an ovarian cyst increases as you get older. It's important to be aware of the two types of cysts. So there's a functional ovarian cyst, which is one that develops as part of the menstrual cycle. These are usually harmless, however, and short-lived. Alternatively, you can have a pathological ovarian cyst. So these are cysts that form as a result of abnormal cell growth. So these are less common, however, they're more serious, so require more immediate and rigorous treatment. Essentially, however, fertility, cysts don't normally prevent pregnancy. However, they can make the conceiving process harder. Next, we learnt about testicular torsion. So this occurs when the spermatic cord, which is from which the testicle is suspended, it twists and cuts off the testicle's blood supply. The most common symptom in children is a rapid onset of severe testicular pain. However, the testicle may also be higher than normal, and vomiting may also occur. The key thing about testicular torsion is the treatment. So it is absolutely essential to try and treat this within 6 hours in order to allow a 90% chance of saving the testes. However, if you get to 24 hours post-injury or post however it's happened, you've got a 0% chance of saving the testes. So acting rapidly here is really important, especially in terms of psychological consequences. A removal of the testes will result in the patient not being able to have children, and therefore it's important really to act quickly. In terms of causes, so rigorous activity, sports injuries is possibly a common way, an excessively large tunica vaginalis, or an inadequate fixture of the testes to the scrotum. Now this sometimes occurs in men and can cause a partial torsion. So this is where some boys and men have warning signals, warning pains in a testicle every now and again. And this is basically leading up to a full-blown torsion. If these patients act quickly and consult their doctor, they can have it surgically fixed. They can have the testes surgically fixed in order to prevent in the future a testicular torsion. Moving on, we looked at embryological kidney malfunctions. Now these were only touched on, however they're quite self-explanatory and they were looked at in some detail last year as well. So a fetal pelvic kidney is a condition that results when a kidney fails to ascend to its normal position above the waist, and it remains in the pelvis due to being blocked by blood vessels from the aorta. Essentially, these two diagrams at the bottom elegantly display the two types of kidney malfunction that we need to know about. So as you can see here, the kidney is not ascended as far as it should do due to being blocked by those blood vessels. And here this is an evidence of a horseshoe kidney, due to the fact it forms a U shape when it fuses, when both kidneys fuse together. This more commonly happens in men than it does in women. A lot of the time, a horseshoe kidney in particular is asymptomatic. And this can be a problem because the patient might not even know they've got a horseshoe kidney until they're admitted into hospital for some other reason and they have a scan. And then find out they've got a horseshoe kidney. What's important with that is they need to be aware of it because they're more susceptible to injury, particularly in contact sports. Moving on, we looked at polycystic kidney disease, which is a genetic disorder in which the renal tubules become structurally abnormal, resulting in the development and growth of multiple cysts in the kidney. The cysts are non-functioning tubules filled with fluid pumped into them, which range in size from microscopic to enormous, and crushing adjacent normal tubules and eventually rendering them non-functional also. This can be subdivided into two types, so autosomal dominant and autosomal recessive, in the way that they're inherited. So autosomal dominant polycystic kidney disease, this is more common, occurs in 1 in 500 to 1,000 people, and it's due to a mutation in the genes encoding for PC1 and PC2. The autosomal recessive form is much rarer. It occurs in 1 in every 20,000 to 40,000 people, and it's due to an abnormality in the gene encoding for the fibrocystin protein. The symptoms are quite different as well, so abdominal pain, high blood pressure, Kidney stones, increased risk in the autosomal dominant patient, and with the autosomal recessive patient, they're likely to have underdeveloped lungs causing breathing difficulties, high blood pressure, excessive urination, and progressive loss of kidney function, potentially being labelled as CKD. The next 3 slides look at genital infections, so it's just a quick tour of the genital infections, and you do need to know more about them from what's included here. So the first one is vulvovaginal candidiasis. So this is an excessive growth of yeast in the vagina that results in irritation. The most common symptoms are vaginal itching, which can be severe. Other symptoms include burning when urination, white and thick vaginal discharge, and pain with sexual intercourse. Next, you've got bacterial vaginosis. So this is a disease of the vagina caused by excessive growth of bacteria. The common symptoms include increased vaginal discharge that often smells. The discharge is usually white or grey in colour, and again, burning when urinating is common. Lastly, on this slide, we look at chlamydia. So this is an STI caused by the bacterium Chlamydia trachomatis. Most people who are infected have no symptoms, and when the symptoms do develop, this can take a few weeks following infection to occur. It's important to be aware as well that chlamydia does occur in both men and women. The second part of genital infections, so you've got pelvic inflammatory disease, which is an infection of the upper part of the female reproductive system, mainly the uterus, fallopian tubes and ovaries, and inside the pelvis. Quite an explanatory disease by the title. It does cause abnormal vaginal bleeding, lower abdo pain, and sometimes discharge as well. LGV is another genital infection which I'm not even going to attempt to pronounce the name of. It's an STI caused by invasive serovirus, or Chlamydia trachomatis, which is the same bacteria which causes chlamydia. Again, symptoms include swollen lymph glands on one or both sides of the groin, pain during urination, constipation, rectal bleeding, and pain in the lower abdomen. Reiters syndrome, this is a type of arthritis which is linked to a bacterial infection in the body, so it's essentially just recognising that there's a link there between STIs and Reiters syndrome. For the third part of genital infections, we look at gonorrhea. So gonorrhea is a sexually transmitted infection caused by the bacterium Neisseria gonorrhoeae. Many people have no symptoms. Men may have burning with urination, discharge from the penis, or testicular pain. Women may have burning with urination, vaginal discharge, vaginal bleeding between periods, or pelvic pain. The last genital infection that we looked at was Trichomonas vaginalis. So this is an anaerobic flagellated protozoan parasite and the causative agent of trichomoniasis. It's the most common pathogenic protozoan infection of humans in industrialized countries. Symptoms, most of the time, 10 to 50% of patients are asymptomatic. However, some patients will present with vaginal discharge and itching, dysuria, and can also cause preterm delivery and low birth weight in pregnancy. Lastly, for this video, we look at benign prostatic hyperplasia. So also called prostatic enlargement. It's a non-cancerous increase in the size of the prostate. Symptoms may include frequent urination, trouble starting to urinate, a weak stream, an inability to urinate, or loss of bladder control. So again, thinking about the normal anatomy of the prostate gland, it links into how increased size will constrict the urethra, put pressure on the urethra, and cause difficulty when urinating. One thing I wanted to highlight with this slide is the difference between hyperplasia and hypertrophy. So hyperplasia is an increase in the number of cells, whereas hypertrophy is a growth in the size of an individual cell. This disease increases in men with their age, and there's a little bit of pathophysiology here to understand in terms of the hormones involved and how that causes the cells of the prostate to actually grow. So essentially it's down to estrogen, which causes the prostatic cell growth. In terms of treatment and management of this, it depends on the severity. Mild symptoms, no treatments really needed immediately, but checkups are advised and changes to lifestyle are also advised. That's everything for this video. I'm sorry it was a little rushed towards the end, however I tried to keep all of these videos under 15 minutes for ease of watching. If anyone does have any feedback, of course, as always, it's greatly received. Please drop me a message or just leave it in the comments below. Thank you very much for watching. I hope you found it useful, and part 3 will be uploaded soon.